Code words are something we use every day. In middle school, they are used to talk about a crush, but for me, it was menstruation. Menstruation can be simply defined as the periodic discharge of blood and tissue from the uterus, but most people use the code word period. In 8th grade, whenever one of my friends or I were on our period, instead of saying the word period, we'd say the word sploosh. As you can imagine, this informative phrase quickly became a silly joke we'd toss around in the classroom. So, although sploosh helped normalize menstruation for my friends and I, it also started normalizing using code words, which contribute to the stigma around menstruation. Instead of saying the actual word period, we kept using the word sploosh as a crutch because we were too embarrassed about having our other classmates know that we were on our menstrual cycle. Now, you may be feeling a bit awkward or wondering, why am I talking about something that happened in middle school? But as I grew up, I found that this is an issue that affects people of all ages on a global, national, local level. In an international study commissioned by a health app, Clue, researchers found that there are over 5,000 different words for periods. The most common terms being on flow, that time of the month, period, and on the rag. So why is it so difficult to talk about menstruation and say the word menstruation? Although there are many reasons, ranging from social pressure to the idea that saying menstruation is a little bit hard to say, it all comes down to the idea that about how we talk or avoid talking about menstruation. Although menstruation is one of the most essential functions of the human body, there's an underlying stigma that leads to people finding it difficult or awkward to talk about with their peers. No matter what the code word is, it's never a positive word. There's the idea that seeps into our minds that saying the word menstruation is shameful and it creates a negative attitude towards our bodies just because we menstruate. When we avoid using the scientific terms for our private parts, we end up contributing to a situation where 1 in 3 people feel uncomfortable saying the word vagina and 3 in 5 people are uncomfortable using the word period. So, although code words such as Shark Week or Girl Flu might seem harmless, they contribute to misinformation that it is shameful to talk about periods in public. UN Women reported that misinformation such as, if you swim, sharks will attack you, or if you look at people while you're on your period, you'll make them sick, have been ideas flowing around the world for years. CARE International reports that in Malawi, periods must be kept secret and parents never talk about it with their children. And in Nepal and India, if you're on your period, women must not touch crops or food because they could cause bad luck to their families or communities. These taboos can lead to misinformation and situations that lead to women feeling diminished or their self-perception and dignity diminished. In State of the Period 2021, a U.S. study commissioned by Thinx, a company committed to providing menstrual products to their users while also educating them on menstrual equity, found that among 1,500 women and 500 men, 3 in 5 women have felt a sense of embarrassment simply because they are on their period, with 2 in 5 women having experienced period shaming and 1 in 5 of these women feeling these effects because of a male friend. Among the 500 men surveyed, they found that 44% admitted to commenting or joking about their partner's mood while they were menstruating. As I got further into this information, I wanted to get more involved with the menstrual equity movement. I joined Red Equity, a nonprofit organization committed to combating period poverty and menstrual inequity, and later founded the Oklahoma branch in 2021. Not only did we start combating the underlying issues of the stigma of menstruation through conversational advocacy, but we also started distributing period products to combat the lack of access to menstrual products. As I got more involved with this issue, I found that there is little to no local data on menstrual inequity in Tulsa, Oklahoma. Last semester, I had the opportunity to conduct my own research on how menstrual inequity affects period poverty among high school menstruators in Tulsa, Oklahoma, and found that 32% of participants don't have adequate access to period products at their high school, and 72% of participants had to resort to a makeshift solution when menstrual products were not available. This means that instead of using normal hygiene products such as pads and tampons, they had to resort to using toilet paper or paper towels, which could lead to fatal health problems such as toxic shock syndrome. On top of this, I found that 1 in 5 participants felt ashamed or embarrassed of their period. And 3 in 4 participants revealed that having their period makes it harder to get work done. So on top of the fatal health effects of period poverty, there's also this underlying stigma which contributes to increased anxiety and a lack in work productivity. So if we can't even talk about our basic bodily functions, how can we even address conversations on menstrual equity? Despite how cringy it might sound, you are part of the solution whether you have a uterus or not. You can visualize your level of impact through 3 different levels that I have displayed here. Level 1 is by eliminating code words. Instead of saying a code word such as period, let's just say the word menstruation. You probably noticed throughout my speech, I said the word menstruation or a variant of the word quite a few times, 36. But, however, saying the word menstruation is a more inclusive term since not all menstruators self-identify as women. Number 2, as Jennifer Wise Wolf, a fellow menstrual equity advocate, best puts it, money doesn't make you special, it makes you lucky. An average cost of period packages is about $5. So instead of getting your daily cup of coffee, you can donate that money once a month to a nonprofit combating period poverty, which leads me to 3. Donate your time to a local nonprofit organization combating period poverty, such as Red Equity Oklahoma. We can't address the overall effects of period poverty without addressing the underlying stigma that creates an additional barrier to menstruators getting the resources they need. So instead of keeping up with the 5,000 different terms that beat around the bush, let's just say the word menstruation. Thank you.